The Therapeutic Alliance literature, which has been on the efficacy of psychotherapy, is now showing that essentially the Therapeutic Alliance is a bond of emotional communication. And that is the central heart of the treatment. So that would be relational. At the same time, the movement in early development is showing that the growth facilitating environment, the attachment, is essentially the same kind of a situation whereby the personality of the mother at deeper levels, not her left hemisphere, but at deeper levels, are interacting and resonating with the baby. Actually, you're looking at her autonomic nervous system regulating the other autonomic nervous system. And then you've got the brain research now showing how social relationships are now impacting the growth of the biological structure of the brain, the interpersonal neurobiology, my work and Dan Siegel's work and so many others, etc. So all of these more or less are coming together now that are highlighting the relationship, so to speak, between the patient and the therapist. But that relationship is not a relationship between two conscious minds, two left hemispheres. Again, that relationship is an intersubjective relationship. It's much deeper than that. It's the same mechanisms that human beings use in intimate contexts. And again, let's remember, with these patients, intimacy is terrifying, right? Is strange, is foreign, is terrifying, etc. So it's that system which again would heighten the idea that the intersubjective, the relational, is central to the treatment. The ability to empathically resonate with someone else's subjectivity is very different than giving another person advice or telling them what to do or how they should be, etc., etc. And I think what we're finding here is that in many cases whereby you see a suicidal crisis triggered, which was precipitated by some type of interpersonal event, which on the surface looked as it was an attempt at some positive, really was not. I mean, in some ways, it could have been more shaming and humiliating and really not a matter of the deep contact that we're talking about here, and more or less keep your affects to yourself, especially the dysregulated one, etc. And so, therefore, many of the precipitating crises are with very close family members. But again, they are literally not making contact because they're just in two different worlds. Again, one in a deeply pained, subjective world, the other in an objective world of verbalizations, etc. And there's no way that they're going to connect up together, and this matter of the exquisite sensitivity to shame and humiliation also, and misattunements, etc., without repair. So in some ways, they've never learned really how to form that deeper intersubjective bond, which may also say that in certain cases of suicide, and incidentally, there you have suicidal children also, right? If it were a suicidal child at 5 years old, we would say straight out, you cannot just treat the child, you have to treat the system. You'd have to treat, the caregivers. Well, it's the same principle, but I don't know how many times we actually see it, later down when it's an 18-year-old or a 21-year-old. I also want to point out one other piece. There is a massive reorganization of the brain in adolescence. And essentially that reorganization is of the same circuits of the right brain. During that period of time, there is an exquisite vulnerability of the individual, and that's why adolescence, because again, if you had a thinned down system where the cortical to subcortical was thinned down early on in infancy, and then you thin it down again in adolescence, that's when you're going to see now the axis 1 disorders popping there. So obviously, adolescence would be a critical period again, perhaps even more so than latency periods, whereby these dynamics come back, play again, and the dysregulation comes back, play again. And then you've got, on top of that, another problem, which is the ability now to auto-regulate in a way that they didn't have before. And that is to auto-regulate by drugs, to change the state by drugs. So you've got that in there too. So I just wanted to point out that we should have mentioned something. The latest studies of, say, borderline adolescents are showing right frontal deficits and are essentially describing it as impaired maturation. I mean, his structures that never did evolve in the first place.